The statement problem is the issue of the infection control is to be one of the most important public health problems throughout the world. These infections is one of the most common complications and the result is morbidity, mortality and the disease cost. It is well recognized that the risk of transmission of the pathogen and providing the nursing care and reducing the rate of incidence in the hospital acquired infection can be kept low throughout the appreciate the standard procedure, but unfortunately the practice are not according to the standard procedures. Significance of problem is firstly there will be defined the new way to achieve the goal. That will help the student to enhance their practices. And the secondary, the poor resource country, the nurses cannot have a proper resources to prevent infection control. They have to use and utilize their proper knowledge, their proper education, their proper perception. Then they have a key post and they have a key resource to know the infection rate. The student will help to organization to develop the infection control plan. Healthcare provider to get control over the infection. The purposes of research are the study find the gap between the knowledge, attitude and practice among the nursing profession and among the nursing students. The research hypotheses are the gap between the knowledge, attitude and practice about the infection control. What are the gap between knowledge, attitude and practice for infection control precautions? They are the knowledge standard precautions and its application. And what is there? The knowledge transmitted based precautions and its applications. These all are her hypotheses. Second is designing and applying. The methodology are my research design is descriptive, conducted in the College of Nursing. There are studies among the 30 students and the random sample we are selected. We have participated at least 1 year of clinical experience. Setting of students conducted by the private sector with the College of Nursing. The target population is 30 students. Sample size we have a randomly selected the 30 students first year, second year and the third year. Tool we are selected the questionnaires. The questionnaire is comprised the 15 questions, 5 based on knowledge, 5 based on attitude and 5 based on practices. Is that clear? My voice is now clear. Data collection procedures, the instrument as a self-administered questionnaire by the Likert scale on the 30 questions administered the study of participants. The pilot study was done and the responded rate is 100%. Ethical considerations are the problem and the purpose is discussed, concern form is taken and the privacy should be maintained and the time commitment is perfectly done. The analysis phase, the data analysis by statistics used to measure the central tendency. The 30 item of questionnaire should be determined. The result shows how would you define infection. There the scale frequency and the percentage. The low frequency is 2. That the percentage is 6.67%. Partially is the 10 frequency and the percentage is 3.3%. The high frequency is 18 and the percentage it shows the 60%. The total frequency is 30% and the total percentage is 100%. How would you define infection? 60% students have a knowledge, 6.67% have a partial knowledge and the 33.3% have a knowledge about infection. What step you follow for doing hand washing? And the 43.3% students have a knowledge about hand washing and 56.7% have no knowledge about the proper steps of hand washing. Performing the hand washing, hand hygiene in recommendation can be reduce the medical costs associated with hospital-acquired infection. In this latter scale statement was 60% students have a knowledge, 36.67% have a partial knowledge, and have a 50 opinions. 3.3% have a no knowledge about the sorry, 3.3% have a no knowledge about controlling infection. Do you think that the isolation is important in infection control? The 50% students have a knowledge that the isolation is important for the infection control, but the 40% have a partially knowledge, and the 6.67% have a opinion that have a no clear opinion whether it is a neutral, and the 3.3% have a no knowledge about the infection. Effective sterilization in the clinical practice can transmit it from one patient to another patient, and this knowledge have a properly have a student 76.6% and 23.33% have a partial knowledge about transmission. And do you have the follow universal precautions in your daily patient care? And the 30% students have followed the precautions in the daily patient care, but the 36.67% have a partially follow, and the 30% is the,
You,
not
ma'am,
having.
you, shh, ma'am, you have 3 more minutes to conclude.
Okay, 3.3% have done the following universal precautions. The someone is performing the hand washing before and after using the patient care. 60% have students performing, the 36.67% have occasionally performed, and the 3.3% do not have the hand washing after enable procedures. When they have performing the hand washing, the antiseptic solution, 66.7% students have a knowledge, and 53% have occasionally, 10% have incidence of opinion. There are a probably disposal of the needle after using, and the 80% have students have dispose of the needles, and the 16.7% have occasionally, 3.3% have they have not properly disposed of. In this case, and the directly blood contents and especially whether they have adopt the precautions or not. 3.33% students have a universally adopted, 43.33% are partially, and 43.3% students are not adopted. These all the statistics of result that we have to share with you, and there are results showing that the major person of knowledge, whether they have their about the knowledge about the infection control, and the yellow color shows that the attitude, and the pink is the practice. Whether we have a gap between the 60% have a knowledge of students, 30% have shown the practices, and the third person have a attitude regarding infection. Discussion whether we have these studies has proved that we have a gap between the knowledge and practices, and this shows that the 60% have the knowledge, but the 10% only whether they have a no knowledge about the infection control, but only the 30% have the practices. In this, we have to conclude this presentation. In conclusion, we have proved that there are knowledge and attitude and practices gap. The limitation of the studies are we have a limited sample, so that's why they are not representing the all population. So that's why it's a limitation of studies. And the implications are the most monitoring of the students will practice while practicing, and they were conducting the workshops regarding infection control, and must be they have to observe the students while they are practicing patient care. So we should be follow the all precautions and procedures to
Ma'am, your time is up. Your time is up, ma'am.